Tail risk in psychiatry refers to low-probability, high-impact events that take a sharp detour from the typical course of a patient's mental health condition or treatment outcomes. Picture a statistical distribution curve. These events are like the tails on either end, representing extreme outcomes that fall well outside the realm of normal expectations. Now, this could mean a number of things in psychiatric practice. It might be a rare but severe incident, like unexpected aggressive behavior, a suicide attempt, or an acute psychiatric crisis that could lead to significant harm to the patient or others. The defining characteristics of these events are their rarity and unpredictability, making them a formidable challenge to foresee and include in regular risk assessments. But here's the catch. Despite their low likelihood, the potential consequences of such tail risks are substantial. We're talking about significant harm that could come to the patient or others. This high-stakes impact makes vigilant monitoring, proactive intervention strategies, and comprehensive crisis management planning absolutely essential. The goal in managing psychiatric tail risk isn't about having a crystal ball to predict these low-probability, high-impact events. Rather, it's about developing and implementing strategies to catch and mitigate these events if they do occur. This involves identifying potential indicators of these extreme events, preparing for their occurrence, and putting measures in place to lessen their impact, all the while ensuring the patient's safety and well-being. So, in essence, tail risk in psychiatry is about vigilance, preparation, and adaptation. It's about being ready for the unexpected and knowing how to respond when the unexpected happens. It's about understanding that while these events are rare, their potential impact is too significant to ignore. Despite their low likelihood, the impact of these events is substantial, making their management a critical aspect of psychiatric care. Dealing with tail risk in psychiatry is not about precise prediction. It's all about strategy. In the world of psychiatry, tail risks represent those rare but potentially catastrophic events that deviate significantly from a patient's typical mental health trajectory. These events, while low in probability, can have high impact, making their management critical yet challenging. The process of managing tail risk in psychiatry is a multifaceted one. It involves a blend of preparation and vigilance, individualized risk assessment, proactive intervention, crisis management and response planning, collaboration and communication, ethical and legal considerations, and flexibility and adaptation. Let's delve a little deeper. Preparation and vigilance refer to the ongoing monitoring of patients, even when they appear stable. This is key in identifying subtle warning signs or changes that may indicate an impending tail risk event. Individualized risk assessment is essential because each patient's experience with mental illness is unique. By understanding the specific risks associated with a patient's condition, mental health professionals can better anticipate potential tail risk events. Proactive intervention involves taking immediate action when warning signs are detected. This can help prevent an event from escalating into a full-blown crisis. Crisis management and response planning are crucial in the event that a tail risk event does occur. Having a well-thought-out plan can aid in minimizing the impact and ensuring the safety of the patient and others. Collaboration and communication between all parties involved is vital in managing tail risk. This includes mental health professionals, the patient, and their support network. Open lines of communication can facilitate a more comprehensive and effective approach to managing tail risk. Ethical and legal considerations must also be taken into account. This involves ensuring that a patient's rights are respected and legal obligations are met while managing tail risk. Finally, flexibility and adaptation are key. As with many aspects of psychiatry, tail risk management is not a static process. It requires constant adjustment and refinement to respond to changes in the patient's condition, new research findings, or changes in practice guidelines. It's less about foreseeing the unforeseeable and more about being prepared and adaptable when the unforeseen occurs. Ever wondered how we confuse the responsibilities between carers and professionals in managing tail risk? Enter collaborative mapping. Collaborative mapping in the context of psychiatry is a strategic tool designed to delineate and fuse responsibilities between carers and mental health professionals. It provides a visual representation of the patient's care plan, detailing the roles and responsibilities of various stakeholders, and mapping out the strategies and interventions needed to manage potential tail risks. These maps are not meant to be static documents, but rather living and breathing tools that adapt to the ever-changing nature of a patient's condition. For instance, These maps may need to be modified when a patient transitions from a care facility to living at home, either alone or with relatives. They should be individualized, taking into account the unique circumstances, needs, and risk factors of each patient. But remember, while these maps are crucial for organizing and streamlining the approach to psychiatric tail risk management, they should never replace common sense or initiative. They are not meant to oversimplify or rigidify the complex and dynamic process of psychiatric care. Rather, they should serve as a guide, aiding in preparation, vigilance, and proactive intervention. In addition, collaborative maps should include footnote and endnote references to individualize them. These notes can provide additional context, elaborate on specific details, or highlight key considerations that may not be immediately apparent from the map itself. This can help ensure that the map is comprehensive yet concise, and that it effectively communicates the necessary information to all stakeholders. Moreover, collaborative mapping encourages communication and collaboration. It facilitates open dialogue and mutual understanding among all parties involved in the patient's care, promoting a more coordinated and effective approach to managing tail risks. Collaborative mapping is a dynamic tool that needs to evolve with the patient's needs. It should be reviewed and updated regularly, reflecting any changes in the patient's condition, treatment plan, or support network. This ongoing process of revision and adaptation ensures that the map remains relevant, accurate, and effective in guiding the management of tail risks in psychiatry. Like any tool, collaborative mapping can have its pitfalls. For instance, it can lead to oversimplification of complex patient scenarios or impose a rigid structure that doesn't account for the dynamic nature of mental health conditions. Communication breakdowns can occur if the map isn't clear or universally understood, and an over-reliance on documentation can overshadow the importance of intuition and common sense. Furthermore, inconsistent implementation of the map, inadequate training of staff, and poor resource allocation can also hinder its effectiveness. Compliance with and regular updating of the map is essential, yet often overlooked. To navigate these pitfalls, consider the map as a flexible guide, not a fixed rulebook. Regular updates, discussions, and training sessions can keep everyone on the same page. Remember, the map should aid, not restrict, your professional judgment. Staying vigilant to changes in patient circumstances and being adaptable are key. Avoiding these pitfalls is crucial in ensuring that collaborative mapping effectively aids in the management of psychiatric tail risk.